Okay, this is day 2 of frog dissection. You should have gotten the same frog. Yesterday we looked at the external structures of the frog. You want to take a quick look at their thumb. It's called a nuptial pad. And in males, this part of the thumb right here would be pretty large. And because this doesn't look to be as large, this might be a female. And we'll look at that in a little bit. Okay, so the first cut that we're going to do, okay, we need to pinch the skin about right here and just kind of snip a hole in it. Okay, and then we're going to take the sharp part of the scissors and put it in that hole, and we're going to cut the skin going all the way to the chin. It gets a little tight around here at the chest area, so just be gentle and be patient. All the way up here. There will be tissues that try to hold the skin onto the muscle. Under here is the muscle. You can kind of just pull it away a little bit, get everything nice and loose. Okay, we're going to do a couple more incisions to try and get the skin out of the way. Starting down here again, we're going to cut pretty much until we get to the spots on the front. Only the skin for now, so lift up a little bit as you're cutting. Okay, then we're going to do the same side cut, but from the chest part until under the arm. Just the skin. And you can kind of pull it back if you want. Okay, we're going to do the same thing on the other side. You're going to cut the skin till you get to the spots. Same thing here. And then just kind of pull it apart. Okay, you want his skin to lay off to the side like that by itself. Okay, so here we have muscle, and we're going to do the same cuts, but we have to be real careful because under here are internal organs that we don't want to chop up on accident. So when you're cutting, lift up a little bit to kind of get away from the internal structures. The first little cut, put our sharp part of our scissors in here, lift up a little bit, take small cuts. Okay, by the chest it's going to get tight again. And you're cutting through the sternum, the breastplate, so you're going to feel a snap. Just kind of lift up a little bit so we're not cutting up the heart, because that's around where the heart's at. Go all the way up. Now we're going to do the side cuts as well, just like we did with the skin. All the way to the side. You might need to lift the arm up to get this, and you'll see some membranes trying to hold everything together. You can kind of cut through that. Okay, as long as this stays off to the side, if it lays off by itself, you can leave it like that, but mine keeps curling in, so I'm just going to cut it off because it's going to get in the way. And just leave it off to the side. Okay, so I'm going to do the same thing with the other side. See, here's more membranes trying to keep everything together. You can kind of cut through that a little bit. this off because it's in my way. Okay, so now we have an open cavity here. We're looking at all, there's a whole lot of things that are kind of squished up in there, but before we start looking at that, I want us to look at the heart first. But in order to do that, we kind of have to open up this breastplate area that we cut, and there's a lot of tissue in here, or membrane holding everything together. So I want you to get your thumb against each side of this breastplate that we cut and just kind of peel it open like that. And you might feel like you're ripping it, and he's not fragile, he's fine. And then so you'll kind of pull it back like that, and what you should see standing out in front of you is this structure right here. It's the heart. This beige bottom portion right here is the ventricle. Frogs only have one ventricle. Humans have two. And then up here at the top, we have two atria. Atria, the darker part. Okay. Some of you guys might have a membrane still covering it, and you can get your tweezers and kind of just get the membrane and pull it away. It's a protective membrane for the heart. Then we have the liver. We have 1, 2, 3. We have 3 liver lobes. Okay. Under that, we have the spleen. It should look like a little shriveled up pea, like peas and carrots, the pea you eat. And then we have our small intestines here. And they're all held together by what's called mesentery. It's another type of membrane that's holding everything together. And within this mesentery, it's kind of hard to find, but I think that's it right there, is the pancreas. Okay. More mesentery, kind of pulling it away. These little finger-looking things here, this is fat. The fact that there's a decent amount of fat means that he ate well, he or she ate well. You can kind of pull that out of the way. Just kind of clean things up. Actually, I'm going to take that back. This is the gallbladder. This is the gallbladder. This is the gallbladder that stores bile. Over here on the other side, this is the spleen. This little round structure is the spleen. Okay. Here we have our stomach. Okay, and if you guys remember, the gullet goes to the gut. The gullet goes to the stomach. Okay. At this point, if you want to cut out the liver, you can. If it's in the way. If it's not in the way, I would leave it alone. Okay? Because we're just moving stuff aside. That's all I do. Some membrane tissue. This structure right here, I want to be real fragile with it. This is one of the 2 lungs. It kind of lays along the side. The other lung is over here. Okay. If we push more of this back, you can see this wavy-like structure here. This is an ovary, so it is a girl. And she should have it on the other side too. Yep, right here. Okay. This back here, I'm going to move some of this membrane, It looks like a maroon, dark colored, like half pecan. This right here, that is a kidney. Pretty big size kidney for this little guy. Okay. This is oviducts. This is where it's attached to the ovary, just in case you wondered what that was. Back here, if you can see it, this white thing that's going down, this is the backbone, the spine. Okay, now if we go back to the other side, we should see all the same things over here. We have fat bodies, little orange fat things, healthy ovary. We have this membrane here that's holding everything together. Kind of pull that away. We have the other kidney down here. The oviduct's in the way. There, right here. Okay. Down here, a little hard to grab and kind of hard to see. This fleshy piece right here is the urinary bladder. It doesn't have any urine in it, so it's kind of flat, but it fills with urine. And then it comes out a hole that's about right here called the cloaca. Everything comes out of this hole right here. So now we can try and see what the last meal was. And by doing that, we cut above and below the stomach. So this is the stomach. Okay, we can cut below, right here. And then we can cut this thicker part that's right up here. Try not to cut the lung, because if you have time, your teacher can show you how you might be able to inflate it. So be real careful in cutting the stomach out. Try not to cut that lung. Okay. Once you have the stomach, you can stick the sharp part into the stomach here and then just cut along the wall. And then open it up and see what their last meal was. If you can tell. Sometimes we can't tell. It's been digested. If you see these little ridges inside the stomach, our stomach's like that too. It's to help give it more surface area. So the last thing he ate was something a little furry. That's about all we can tell. Okay. If you have time to inflate the lungs, your teacher will give you a plastic pipette. I don't have one on hand right now, it's fine. And then you will try and isolate a lung. Okay, be careful, they're very, very thin. Okay, and you're going to try and inflate it like a balloon. And by doing that, you stick the pipette into what is considered our trachea, but for the frog, it's the glottis. You'll stick your pipette in here and then inflate some air. Okay, and then when you pinch the bulb to push some air in, you should see the lung inflate. If you have time, you can also cut through the skin here and look at leg muscles. They have huge muscles. If you have time, you can also take the insides out and get a good look at the inside of the body cavity. If you have time, you can, in a humane way, and for science sake, for learning, you can take out the eye to see what the eyeball looks like. Other than that, that's all the exploring you should probably do.